Welcome to Desert Living, where we connect you with everything that makes the Coachella Valley a wonderful place to live. Desert Living starts now. Here's Brian Gallo.
Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate that occurs as men age. Studies show that 40% of men in their 50s have BPH, as do 80% of men in their 70s. Well, now there's a breakthrough outpatient procedure that can help. Here to tell us about it is Dr. Lance Walsh with Walsh Urology Associates, along with patient Dr Schmeck.
Hi, Brian, thanks for having me on.
Oh, we love having you on, buddy.
Thank
How are you? Nice to see you. New face. We love new faces.
Yeah.
So I'm going to start with you, ask you a few questions. I'm going to get to a question for you, a special question. So for folks that haven't watched or don't know, what is an enlarged prostate?
Well, BPH stands for benign prostatic hypertrophy, which is just a benign enlargement of the prostate. The problem with it is that it surrounds the urethra and can close off the urethra like a vice.
Oof.
So that can cause all sorts of problems with urination, either weak urine stream or frequency with urination, and that's why people seek treatment.
Gotcha. So some of the symptoms are kind of reduced to urinating.
Correct.
What about sex?
Sex, you know, generally the BPH isn't associated with erectile dysfunction or problems, but the treatment for BPH is.
Okay.
So when we talk about treatment options for BPH, there's medications. Medications generally are mildly effective, but a lot of them can cause sexual side effects, either causing a low libido or sex drive and affecting ejaculation. When you have an orgasm, nothing may come out. Other more aggressive options have been surgery like a TURP, transurethral resection of the prostate, or green light laser, or holmium laser enucleation of the prostate. Those are generally maximally effective, but they can really have a problem with people's sex life. That is, they can cause retrograde ejaculation, they can cause problems with getting an erection, and there's also surgical risks associated with it. So I'm excited to talk to you today about kind of an in-between option, the UroLift. The UroLift has been FDA approved since 2013. I've treated over 500 patients, the majority of which have been in my office with just a local anesthetic. The benefits is that it's far more effective than medication with much less side effects than surgery. So for instance, the UroLift is the only treatment option for BPH that's been studied that's been shown not to have any sexual side effects in the men that have been studied so far. So there's not been any new cases of erectile dysfunction or new cases of erectile dysfunction following the placement of a UroLift. Its main side effect, as opposed any surgery has a risk of bleeding or small risk of infection, but it has about a 1% risk of a urethral stricture, which is scar tissue in the urethra, and that's also shared with the other surgical option as well.
Gotcha. And you're one of the only ones that does UroLift here in the Valley, right?
Yeah, I mean, I think all the other urologists are capable of doing it, and I think they do it. We just have a very large clinical experience, and we're a center of excellence, and I published the authoritative paper on how it's done in the office setting.
All right, gotcha. Okay, so Mr. Schmeck,
Yes.
back to you. So let's talk about symptoms that you had before you actually had the UroLift.
Well, to start with, I had to go to the bathroom every night about 5 times.
Literally?
Oh gosh, it was terrible.
Wow.
And I took pills for it, which is a pain in the neck, because they didn't really work that well. And when he talks about some sexual stuff, it does help, because I'm having fun now.
Nice, I love it. What was recovery like?
And I can thank my doctor for recommending this guy.
Yeah.
He says you could be a candidate for the UroLift.
And you
I
were.
had no idea what it was, but it works.
Nice, all right. And as far as recovery goes, easy breezy?
Look it, I play pickleball every day.
So you obviously would recommend UroLift.
Oh, absolutely.
All right, I appreciate you being here. Walsh Urology Associates is located in Rancho Mirage. For more information about the UroLift system, give them a call or check out their website at walshurology.com. A big thanks to these two for being on the show. Quite informative. We'll see you after the break.